Now the topic being the hepatitis, that is a hepatitis viruses. So firstly, as we begin with the questions, the first question being, what family does the HIV belong to? Hepatitis A virus, which family does it belong to? Second one being the antibodies. What are the antibodies which are present in the HBV? What are the antibodies present in HBV? And next, the treatment option in case of the hepatitis HDV, that is hepatitis D virus. What is the treatment option? So we're going to find all the answers in this video. So firstly, we are discussing about the HIV. So the HIV, there is the specific name being the hepatovirus A. It is nothing but the hepatovirus A. And what family does it belong to? The family being the Picornaviridae. Then looking at the envelope. So what is the envelope? It is non-enveloped, Ne. And what is the nuclear material which is present? The nuclear material being the ssRNA, single-stranded RNA. Then looking at the antigens, it includes the HIV-AG. And what are the antibodies present here? The antibodies, it includes the anti-HIV-AB. And next, moving on to how does the HIV virus it transmits. So looking at the transmission, the route, it includes it can be the fecal-oral, as well as the parenteral as well as sexual. Next, we move on to the incubation period. So the incubation period being the 30 days, and looking at the chances of the fulminant hepatic failure. So this is about 0.1%. And looking at the extrahepatic manifestations, it includes the presence of rash and the arthralgia. All this is with respect to the HIV. So when does the resolution of the acute infection take place? Acute infection and its resolution. So this occurs at 2 months. Next, we look at the progression to the chronic infection. So in case of progression to the chronic infection, so does it? So the answer is no. And next, looking at the HCC, this is also, it doesn't occur. Next, we look at the vaccines. So is there a vaccine for the hepatitis A? So in case of the hepatitis A, is there a vaccine? The answer is yes, it is available. And next, looking at therapy, there is none. Now we move on to the hepatitis B. So looking at HBV, the specific name being the hepatitis B virus. And looking at the family, it is nothing but the Hepadnaviridae. And is it enveloped or non-enveloped? So the answer being it is enveloped. Then looking at the nuclear material, what is it? The nuclear material is that it is partially double-stranded DNA. Now, what are the antigens present? So the antigens, it includes the HBsAg, next the HBcAg, then the HBeAg, next the HBxAg. Now we look at the antibodies. So in case of the antibodies, it includes the anti-HBsAb, then the anti-HBcAb, and next the anti-HBeAb. Next, we jump to the routes of transmission. How is the hepatitis B is transmitted? So the routes, it includes the perinatal as well as the parenteral Next, it can also be through the sexual route, the percutaneous, and the direct mucosal contact. Next, we move on to the IP. The incubation period is about 60 days, and it shares it with the hepatitis D. This is also 60 days. So now looking at the chances of the fulminant hepatic failure. So this chance is about 0.1 to 1%. And next, looking at the extrahepatic features. Extrahepatic features of the hepatitis B. This includes the presence of the polyarthritis, nodosa, and also the membranous nephropathy. Then the question being, when does the resolution of the acute infection? So the resolution of the acute infection, this takes place at the 6 months. And next, the progression to the chronic infection. So this takes place, this is about 5 to 10%. Then we look at the HCC. So the HCC is, it may develop in the chronic infection. And then what is the question being, is there a vaccine available? Yes, availability is there. And then looking at the therapy, it includes the entecavir, then the tenofovir, as well as the PEG-IFN alpha. Then we jump on to the hepatitis C. So the HCV, that is in short known as the, so the family being the Flaviviridae. And is it enveloped or non-enveloped? Enveloped or non-enveloped? So the answer being, it is enveloped. It is enveloped. And then looking at the nuclear material. What is the nuclear material? So the nuclear material here is that it is all this is hepatitis C. So the nuclear material here is ssRNA. That is a single stranded RNA. And looking at the antigens being the HCVAG. And what is the antibody? Antibody is nothing but the anti-HCV-AB. Next, we move on to the auto antibodies. So here in case of hepatitis C virus, the autoantibodies is the anti-LKM1. And how is the route of transmission? So the route of transmission is that it is the parenteral, it is perinatal, as well as it is percutaneous, as well as it can be through the sexual route. So the incubation period of the hepatitis C is it is about 50 days. And the chances of fulminant hepatic failure is about 0.1%. And what is the extrahepatic manifestations? Extrahepatic manifestations, this includes about there is essential, mixed, cryoglobulinemia, there is MPGN, as well as there is presence of the metabolic syndrome. Then we move on to the resolution of the acute infection. So the resolution of the acute infection, this takes place at about 6 months. And now looking at the progression of the chronic infection. So the progression of the chronic infection is greater than 80%. Then what about the HCC? So it may develop in case of the chronic infections. In chronic infections, it may develop. And then looking at the vaccine. Vaccine is unavailable. And then looking at the therapy. Therapy, it includes the Velpatasvir, sofosbuvir as well as the ribavirin. Next, we move on to the HDV, that is the hepatitis D virus. So the hepatitis D virus, looking at the family being the Colmioviridae. Okay, so that's nothing but the genus of the delta virus. And is it enveloped or non-enveloped? It is enveloped from the HPV. And what is the genetic? It includes the circular defective ssRNA. What are the antigens? So the antigens include the HBs AG as well as the HT AG. Next, what are the antibodies? Antibodies, it includes the anti-HBs AB, the anti-HDV AB. Next, we move on to the auto antibodies. In case of the auto antibodies, it includes the anti-LKM3. Next, looking at the route of transmission, this is either it is parenteral as well as it can be sexual. Then looking at the incubation period, it is about 60 days. Next, chances of fulminant hepatic failure, it is about 5% in case of the co-infections and about 20% in case of the super infections. Then we look at the resolution of the acute infection. So looking at the resolution of the acute infection, it includes 6 months. It includes 6 months. And next, looking at the infections, the progression of the chronic infections. The progression of the chronic infections. So this is about 10%, which is co-infection, and 90 to 100%, this is about the super infections. And then looking at the HCC. HCC is that it may develop in case of the chronic infections. And what about the vaccine? Vaccine is, there is the HPV vaccine, and therapy is by the PEG-IFN alpha. Lastly, we look at the hepatitis E. So in case of the hepatitis E, it is known as the orthohepivirus A. And looking at the family, it belongs to family Hepiviridae. And is it enveloped or non-enveloped? It is quasi-enveloped. What is the genetic material? It includes the ssRNA. And what is the antibody? Antibody is, the antigen is the HEV AG, and the antibodies is the anti-HEV AB. Next, looking at the transmission route. The transmission route is that it can be fecal-oral, it can be zoonotic, as well as vertical. Then the question arises, what is the incubation period? So the incubation period, it includes about 40 days. And next, looking at the chances of the fulminant hepatic failure, this is about 1 to 2%, and this is in case of the adults, and then up to 25%, and this is in case of the pregnant women. Next, we look at the other features, that is the extrahepatic features. This includes the GBS, Bell's palsy, pancreatitis, and the glomerulonephritis. Then what about the recurrence, the resolution of the acute infection? So the resolution of the acute infection is 3 months. And what about the progression to chronic infection? So the progression to the chronic infection, it develops only in case of the immunocompromised, and next we look at the presence of HCC. It is not present, or it can be present in case of the chronic infections. Then looking at vaccine and therapy is none. Now to answer the questions which we initially asked, so the question was, in case of the hepatitis A, so this belongs to which family? So the hepatitis A, it belongs to the Picornaviridae. Then we saw in case of the hepatitis B, what are the antibodies which are seen in hepatitis B? So the antibodies, it includes the anti-HBsAg, anti-HBcAb, as well as the anti-HBeAb. Next question was, what is the therapeutic management in case of the HDV? So the therapeutic management is by the PGIFN-alpha. Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.